This is a case of a young patient with Brugada syndrome, implanted with a single lead ICD and with a lead dysfunction, a lead fracture. This tracing is characteristic, with very fast unphysiological signals that are intermittent within the cardiac cycle with variable amplitude and some of the signals saturating the amplifiers. Here the VF counter is filled, prompting the charge of the capacitors, but no inappropriate therapy will be delivered since this oversensing was intermittent. So this patient did not receive inappropriate therapy since we could change this lead after an early diagnosis permitted by remote monitoring. This is now a second patient with a lead fracture. You can recognize the typical aspect with very fast, disorganized signals, some of these signals saturating the amplifiers. And you can see on this tracing the terrible consequences associated with the lead dysfunction, and this patient received multiple shocks. And we know that this kind of situation will be very detrimental for the quality of life for the patient. Of course, will increase the consumption of the batteries, but will also have a detrimental impact on the prognosis, since that we know that there is a direct relation between an increased mortality and a high number of inappropriate or inappropriate shocks. Now, this is a third patient with a lead dysfunction. You can recognize the typical aspect of the tracing, and this tracing highlights the interest of the secure sense algorithm that has been specifically designed to decrease the amount of inappropriate therapy in case of lead dysfunction. You can observe very short cycles because of the oversensing at the level of the bipolar channel, but there is no oversensing in the discrimination channel, and you can see just one signal that is sensed on the discrimination channel, which is the QRS complex. So, since there is a discordance between the bipolar channel and the discrimination channel, tachycardia in the bipolar channel, but no tachycardia in the discrimination channel, there is a diagnosis of lead noise, and the therapies are inhibited. This is of all the major interest of programming the secure sense algorithm.